Greetings. My name is Bob Johnson. I babble on a lot about stuff because my medication is that quality health care that we get, where the doctor, you go see your doctor for like 5 minutes or so, and he looks at you and says, I have a pill for that, and sends you on your way, and you just go home and take your happy pill and go about your day. And they never determine what the source of your problem is. So perhaps that they won't have to charge the healthcare insurance companies any more money than what they need to, but they can just send you on your way with your happy pill. As long as you're taking your happy pill and you're functioning in your daily life, that's really all that freaking matters. So maybe 5 or 6 years later down the road, you're still taking your happy pill. Things are getting worse and worse, and the doctor just says to you, "Well, I gave you your happy pill. That's all you really need to use. I'm not going to do no tests. I ain't going to do anything it can't do anything for you. So here's your happy pill. Go home and continue taking that. And if that don't work, we got a bunch of happy pills we can prescribe to you to make you even more happier. So just let us know when you need some more happy pills, and we'll get right with you." That's the reality of our health care, especially on Medicaid and Medicare. Now the thing is that if you really want to give it quality health care insurance, honestly, you sure aren't going to try to manipulate the doctors not to do this or not to do that. It goes back that the relationship between the doctor and the patient is between them two only. No one should ever intervene between that relationship or try to tell them what they can have and what they can't have. Because the thing is that people are going to end up getting sick and die sooner. When you're trying to have taxpayers to be healthy, be productive, trying to pay taxes, trying to live in this country the best way they can. Now the thing is that if you want their money, this government wants their money, then this government needs to ensure, number one priority, that these taxpayers are having the best quality care in the world. Because if it wasn't for them, they wouldn't have their jobs. It comes down to that we, the so-called people, are the employees. They are the we are the employers, they are the employees. And why should our employees have better health care coverage than us, the employer? So the thing is, if we the people, and it's us who are the employer, and they are the employee, well then we need to take control of their spending and let them say, well look dude, you may be the president of this so-called organization, of the so-called government, but let me tell you, you don't need $100,000 to live off a year. And there's people out there living off less than $10,000 a year. So here's the deal, we'll give you $20,000 a year. We'll give you straight Medicaid. Hell, we might even throw in a food stamp, maybe $5 worth of food stamps for you. So that way you can go out and buy yourself some food, that $5 food stamps. And we'll do the same thing with these people who so-called work in the Congress, because they only make decisions based on what they think is best. And let me tell you, they only care about their own interests. They have their health care. They have their fame, their fortune, and wealthy lives. And we need to figure out who these individuals are. Find out which ones are righteous and true and sincere. Find out which ones are sadistic. The ones that are being purchased for a price. Because Congress right now is presently being purchased by a price by corporations in healthcare, oil companies. They purchased this government for a price, because technically, if we really wanted to get rid of vehicles with taking oil in cars, we can do it. As technology has already proven, we can have cars run on water. We don't need no freaking oil. We don't need no freaking gas. And when in the healthcare, we don't need no freaking health insurance company telling us what we can have and what we can't have for our health. So if we're the employer, We should have the best quality care there is in the whole world so that we can maintain being productive in our lives, living less stress, ensuring that people are taken care of, being treated equally with health care, being treated care equally financially, and ensuring that they have a safe and healthy environment to live in, and get rid of these sadistic beliefs, these sadistic practices of trying to manipulate people into all this bull crap that they keep trying to peddle. And stop playing these childish mind and word games. They need to keep it real. And if they can't do that, then this society will never get any better. Well, this is one of my videos signing off because I'm about running out of minutes. So keep it real, people. Love each other unconditionally. Have a wonderful day.